My full name is Elsie Graves. I am the Vice President and Chief Nursing Officer for Advent Health, Lake Placid, Sebring, and Wauchula. When I first learned about Banyan, there was no apprehension about the program. And the reason why there wasn't apprehension about the program, because I know that virtual care is the future of medicine and the future of healthcare. And so learning how the nurses interacted with the nurses that were here in the hospital at bedside was an opportunity to further enhance nursing and to deliver high quality care to our patients. I have experienced since I've learned about Banyan is that there's a very supportive team. Maria has been wonderful. Maria Hagan, our account executive, has been wonderful working with the team, as well as the nurses who routinely come to the hospital and help the team members on the floor in addressing any concerns that they may have. I will tell you that it is a nurse satisfier. Nurses, I think, were a bit apprehensive when the program came out, not understanding how virtual nursing could fit into today's medicine and in bedside care. However, learning that the virtual nursing helps to take at least 30%, if not more, of the administrative burden off of them so that they can be at the bedside and provide care to our patients. That has been truly a godsend for us. What I like best about the virtual nursing program is that the amount of workload that they take off of the bedside nurse, the administrative data, which is so important in delivering care and making sure that we have accurate information and making sure that it tells the patient's story, is probably one of the most significant pieces. And if that is omitted or not complete, then that really affects how care is delivered. And then the virtual nurse actually is a great partner with the bedside nurse in that they help to verify medications. They help to educate and reinforce education with the patient. They reinforce education and instructions given by the physician. And then they're also that extension for our LPNs. We just recently introduced LPNs, or not just recently, but when we started with the virtual nursing program, we reintroduced LPNs at the bedside and in the acute care setting. And so they are a huge resource for our LPNs, as well as our novice nurses, our new graduate nurses. And so we have appreciated them, and I've appreciated them so much for what they bring to the table in terms of delivering care at the bedside. I will start with the type of results that we are seeing. I will start with the satisfaction of the nurses with the virtual care nursing. And I'll just give you this as an example. So one weekend in our 2 med-surg units where we have the virtual care nursing, we have 67 beds that are under the virtual care program. We had a total of 68 transitions in that weekend. So if you think about it, that's one more transition than we had the number of beds. And even if you had a person that was doing admissions and discharges on a daily basis with our team, they wouldn't have been able to keep up with that workload. And so that's where the beauty of the virtual nurse working with the bedside nurse has enabled us to do more for the patient and to make sure that we tell the story of what's going on in the clinical picture and reinforcing the education. And so having the virtual nurse there to take a lot of that load off enabled those that were at the bedside to be able to reinforce and to do that clinical care that's needed at the bedside.